Wake up! It's the Sleep Unplugged podcast, episode 181, Sleep Aids and Dementia, All Manner of Pills. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you're new to the Sleep Unplugged podcast family, welcome. If you're a veteran, welcome back. We are glad you're here. If you want to get in touch with the show, you can via our social media, Dr. Chris Winter Instagram, Dr. Chris Winter Twitter, Bluesky Threads. We have a YouTube page with dedicated videos. If you're watching the YouTube page, you see I'm representing the UVM rugby t-shirt. They have made it to the Final Four in the Division II Collegiate Champions. They will travel to Houston to play for the title. Big shout out to the University of Vermont Catamounts. Let me tell you, I've seen them play. I would not want to be their opponent. So good luck to you, gentlemen, on the pitch. Um, Shout out to the lovely people in State College, Pennsylvania. I was up there lecturing this past week, saw the lovely snow. What a beautiful town. Just idyllic this time of year. Really appreciate your hospitality. Another big shout out to friend of the show, Andrew Spector down at Duke University. I am a University of Virginia alum and was really shocked to see the University of Virginia Cavaliers lose in the ACC championship game until I remembered that Andrew Spector, friend of the podcast, author of Navigating Life with Restless Leg Syndrome and sleep specialist extraordinaire himself, actually advises the Duke University athletic program. And he wrote me a note, said, hey, or he posted something on social media, and I said, congratulations, this is awesome. And there was a comment about, too bad that, your team UVA. And I said, let me make something very clear. It is my team in that it is my alma mater. I went to undergraduate there. I did my neurology residency there. I do not work with the University of Virginia football team. And there's a funny story there in that the University of Virginia women's basketball team wrote me in 2024 and said, hey, we would love for you to work with our student athletes. I was like, great, would love to. And this is, we were kind of working out the details, the dates. I said, here's what I charge. And they said, oh, well, we were kind of hoping you would do it for free. And I was like, yeah, those days are long gone, sister. That was the Chris Winter 15 years ago who would do it for a t-shirt and a hat. That doesn't happen anymore. So I said, well, it's okay. Let me do this. Let me write the University of Virginia athletic director. I have worked for colleges before. Hello, George Mason, and there's a couple others out there that have brought me in. And I work with like sort of all the athletes over a day, and different teams kind of rotate in. It becomes a very efficient use of time and money. So I wrote the UVA athletic director and said, hey, I'm Chris Winter. I'm a alum and I do this sleep research. I work for all these professional sports teams. Your women's basketball team reached out to me and I thought, hey, why don't we work something out where I work with many of your clubs and maybe we could make it worthwhile for everyone. Never heard a peep back from them. So all that said, congratulations, Dr. Spector, and congratulations to Duke University. You played exceptionally well, and congratulations, the title is yours. A quick comment, correction, criticism. I think this is like the first episode in like 8 or 9 weeks we haven't had a sponsor. So when we don't have sponsors, I like to answer viewer letters. And this is from Sly, who wrote, love your podcast and topics you cover. I enjoy the musical references at the beginning of the podcast. Often when I can't sleep, I listen to your podcast and at times fall asleep while listening to it. See, you're either becoming more educated about sleep or it's sedating you. Either way, you win. I will wake up in the AM with my earbuds still playing. At times, I incorporate the content into my dreams. Is there a problem with doing this? Sometimes I find that I've listened to multiple episodes. The second question regards the use of wireless earbuds. I know you had a show on earbuds, but did not cover this issue. Does using Bluetooth-enabled earbuds for an extended period of time have any potential consequences? By the way, I travel a lot for work and appreciate your travel pointers. Thanks for entertaining my questions. I'm going to defer the second question about is are these devices harmful? My lay answer is that they are not. I know there have been studies looking at this, but this is a very difficult thing to study, and I know a lot of people try to eliminate electronics from their bedroom, have devices that kind of block the waves and stuff like that. I don't think any of that's harmful. I just don't think anything has ever really been proven, but I can't say that I'm a real expert on that. In terms of using sound or a podcast to fall asleep, my litmus test is, do you require it? Or is it something that you just kind of like to do? Meaning, you travel a lot, you out of town, and when you get to the place that you're going, you realize, oh my gosh, I forgot my AirPods. Are you freaking out and you're going to have a terrible night of sleep? Or is it, oh, it's no big deal. I can sleep without them. I just like to listen to Sleep Unplugged when I fall asleep. So I think if you're the latter, it's fine. If you're the former, I always like these things to be supplements to sleep, not dependencies. Same thing for a noise machine. Same thing for a special blanket. Any of the products we mentioned a few weeks back in our Black Friday episode, these are things that are going to enhance sleep, but we don't want to depend upon them. So I really appreciate that question, Sai. It was a really, really good one. Our musical reference this week is the Britpop band Blur, and the line "All Manner of Pills" is from the lead single off of their fourth album, Great Escape from 1995. I was a really big Blur fan. I was a really big Britpop fan, still am. Although I probably leaned a little bit more towards Oasis and Stone Roses versus Blur, but I certainly like Blur. And I've actually liked Blur more as I've gotten older. They've got some really, really interesting music. And I think when you look at all the Britpop bands, their music really matured and changed more than all the other bands, I think Oasis included. I mean, take a listen to The Great Escape 1995 and then listen to their album Think Tank. Has that Banksy cover on the front of it. Think Tank is a really complicated, interesting album that I keep coming back to at various times in my life. I think it's really great. Anyway, so I think Blur is fantastic. The song that All Manner of Pills came from was Country House, which was the lead single off of Great Escape. And what's interesting is this came out in 1995, which is the same around the same time that What's the Story Morning Glory came out, which was Oasis's second album. And the media in Britain like to pit Oasis and Blur together, against each other in this sort of Brit pop competition. And this all came to a head when What's the Story Morning Glory came out. The first single off of What's the Story Morning Glory came out in April, and that was Some Might Say. And then the second single off of What's the Story Morning Glory was set to be released August of 1995. And Blur's management intentionally changed the release of Country House to August of 1995 to sort of pit them against each other. So both bands had two singles coming out at the same time, August of 1995. And the competition was who's going to sell more singles in that, whatever that time period was. And it turns out that Blur edged out Oasis by several thousand records and were proclaimed the winners of the Battle of Britpop. And you want to see a great performance. There are actually two performances Blur did on Top of the Pops of this song. You can watch the first one, and then the second one, you'll know it's the second one because it's hosted by Bjork. The crowd is literally singing along with this song so loudly. I don't think I've ever heard a crowd know the lyrics to a song so well as this song. These are great performances. And what's really cool is Blur is pronounced winner of the Battle of Britpop, and then that was in August. In September, Morning Glory came out from Oasis. Whatever, lukewarm. And then October 1995, The Levee Breaks, Wonderwall, followed by, a month or two later, Don't Look Back in Anger, and then finally Champagne Supernova. So a lot of people like to say Blur won the battle, but Oasis won the war. So anyway, we'll put Country House. It's the most addictive song ever on the Volume 4 of the Sleep Unplugged Spotify Music playlist. And yeah, enjoy. We love Blur. So moving on to the podcast, this is interesting because a couple weeks ago, I was getting all these DMs. Even my wife sent me a post saying, "Hey, have you seen this about dementia and sleeping pills?" And I was kind of like, "No, I haven't." I mean, I was aware of research around dementia and sleeping pills, and we've done an episode on dementia before. It was episode 99. Of course, this is the first Monday of the month that we're doing here. So, first Monday of the month is always Insomnia Monday. So I thought insomnia, sleeping pills, dementia would be a great topic. So I was getting on these texts about, hey, have you seen this research coming out about dementia and sleeping pills? And I'm like, no, I'm not aware of any new research. And so as I started digging into all these social media posts that people were posting, et cetera, it was all related to older research that came out of California um, back in 2023. This was a UCSF led health analysis. It's all published in the Journal of Alzheimer's Disease in 2023. It got a lot of press, and for some reason, there was a resurgence of interest in this on social media that kind of led to a lot of people asking questions. So I thought, well, even though it's a little bit dated, it's a great topic. And there are a few really good research publications that we should kind of go through and talk about. So that is the genesis for this episode. I will throw out the disclaimer. If you've listened to this podcast and you've listened to episodes I've done on sleeping pills, I'm not a fan of sleeping pills. I'm not trying to scare you about sleeping pills, although there might be some scary things about this episode. My biggest complaint about sleeping pills are number one, they're completely unnecessary in most cases. And number two, they don't work that well. And don't take my word for it. Again, you can listen to old episodes of the podcast, look at the data related to the sleeping pill you're taking, if it even exists. We're generally talking about helps you fall asleep a few minutes faster, helps you stay asleep a few minutes longer. I don't encounter a lot of people taking sleeping pills for that reason. Hey, Chris, I'm looking for a pill that might make me sleep 7 minutes longer on average per night. Great, I've got a pill for you right here. It's mostly, hey, Chris, I can't sleep without a pill. I don't care what you say. I don't care what your colleagues say. I don't care what the research says. If I get in bed without a sleeping pill, I'm not sleeping. And that's just simply not true. Humans sleep. It's impossible not to sleep. So I think this adds another level of, are they necessary? No. Do they work that well? Not really. Could they be potentially harmful? Well, of course. A lot of them are addictive. They can cause sedation and poor judgment and falls in the elderly, et cetera, et cetera. But I think dementia is a specific risk factor that we really want to look at. So, are my sleeping pills going to give me dementia if you're taking them? And if you've seen those headlines coming out of California, it's usually framed as sleep medications raise dementia risk. And that's really what we're kind of talking about today. So, in this episode, I want to do a few things. Number one, we're going to walk through what sleeping pills actually are briefly. Number two, dive into the three of the strongest recent studies that try to link them to dementia. And links important. We've talked about this before. Links and causality are really two very different things, but I think it's important to explore what we see here. And number three, we're going to talk about this, in terms of real patients, what we actually know, what's still murky, and kind of what we recommend in practice. So, what do we mean by sleeping pills? Generally, when the media is talking about sleeping pills, they're usually talking about several different categories of medications. Number one, benzodiazepines, anything that ends in PAM, clonazepam, lorazepam, alprazolam, diazolam. Uh, these are medications that I always call them disco and bell bottoms sleeping pills because they've been around since disco and bell bottoms and well before. They were very popularized in that time. Rolling Stones, Jefferson Airplane wrote all kinds of songs about, mother's little helpers and things of that nature. And there's the Z drugs like the Ambiens, the Zolpidem, the Sonatas, Lunestas, etc. So they're kind of hey, these are the safe sleeping pills and they're great. And they gained a lot of traction and for a period of time were quite popular. Sedating antidepressants really don't have an FDA approval for sleep. They're always used as kind of off-label hypnotics, capitalizing on the sedating property of the drug, trazodone, Remeron, which is also called mirtazapine, doxepin, and a lot of people are prescribed these medications. Whenever I see, you know, 50 milligrams of trazodone at night in a person who's not depressed, I know exactly why they're taking that medication. And finally, antipsychotics at low dose. I irritate. We will do. I feel like we did a podcast on that. If we haven't, that'd be another good Insomnia Monday. If you're taking, an antipsychotic for sleep, I think that's ridiculous. If you're psychotic, perfectly fine. That's what the drug is for. But using these drugs to sedate people, I think I don't know where it came from, but it needs to stop. So mechanistically, many of these drugs work through GABA A modulation. GABA is that neurotransmitter that's really important for down regulating the central nervous system, especially benzos and Z drugs, which already give us reason to be cautious about their long-term use in older brains. GABA is also something that alcohol tends to interact with as well too, creating that sedating property. So the other key background piece here is that insomnia and fragmented sleep themselves are often cited as risk factors for dementia. So you can already see the problem we have with the relationship. If you have fragmented sleep for whatever reason, let's say you have sleep apnea, which is a risk factor for dementia, but you live by yourself, so you have no idea. You stop breathing and have all kinds of choking and gasping throughout the night. All you know is you go to bed and you wake up a lot during the night and you're tired the next day. Who's going to ask their primary care doctor or seek out a sleep aid? That person is. And they already have sleep apnea, risk factor for dementia, as well as fragmented sleep because of the sleep apnea, risk factor for dementia. So all these things have been linked in cohorts to be higher risks for dementia. So whenever we see a study that says sleep medication use predicts or leads to dementia, we have to ask the question, is it the pill or is it the underlying insomnia, depression, other medical history, other medication use that's leading to this predisposition for dementia? Even early dementia could be a risk for dementia in this population. So the confounding headline is often problematic when we talk about that. So with that in mind, let's talk about the California study. This is the UCSF Health ABC California study, published in 2023. The lead author of that was Lang, L-E-N-G. So that study generated California headlines because it was published in the Journal of Alzheimer's Disease in 2023, widely distributed by that university's media office. And that's important. We talked about that a few weeks ago, where it was when the cardiology group had their big conference and they were talking about melatonin causing heart failure or whatever. Like, it's important for these universities to get their name out there. In a typical world, universities are trying to attract talent and research funding, and it's important for them to get their name out there. So UCSF definitely did a good job of putting this information out, and the media gobbled it up. Sleep apnea or sleeping pills causing dementia. Tell me more, please. So the design in a nutshell, was basically looking at about 3,000 community dwelling adults, average age was 74, who had no dementia at their baseline. And then they followed up about 9 years later. The race was 58% white, 42% black. The exposure, self-reported frequency of prescription sleep medication was rated basically never rarely, sometimes, other, which was thought to be around 5 to 15 times per month or almost always. So they're taking this 3,000, population of 74-year-olds and stratifying them based upon how frequently they're using sleeping pills. Meds included benzodiazepines, the Z drugs like Ambien we talked about, sedating antidepressants like trazodone, and the key results were around 20% developed dementia over follow-up. Among white participants, those who used sleep meds often or almost always had a 79% higher risk of dementia than those who rarely or never used them, even when you adjusted for a lot of the covariates. Among black participants, frequent use did not have a higher dementia risk. Their risk looks similar to non-users. And white individuals in the study were much more likely to be taking benzos, trazodone, and Z drugs. So, in this study, if you're a white older adult using prescription sleep meds pretty regularly, your risk of dementia over about a decade was roughly 1.5 to almost 2 times higher than light or non users. If you were black, the association wasn't really seen. So, this is observational. We can't say the pills cause dementia. The race differences may reflect socioeconomic selection. Black participants using meds tended to be higher, had sort of more cognitive reserve, differences in the specific drugs used and dosages. Dementia is multifactorial, and sleep meds are just one part of a very complex puzzle. Still, this is a very large modern cohort with a very decent follow-up and careful adjustment. So it's absolutely one of the anchor studies in this field. So again, we're living in a time where before you listen, a week after you listen to this podcast, if this information falls into certain hands, they may be outlawing sleeping pills because of dementia. I mean, who knows? Um, I have no idea what to expect currently right now with policymakers when it comes to health education. A lot of times I don't think they understand it. So is this a big effect? Yes. But again, who might be taking these medications is really the question we need to be asked. So study number two was a 2021 study, um, NHATS, a national United States sample. So next to Rebecca Robbins and colleagues using the National Health and Aging Trends study, a nationally representative cohort of over 6,300 US adults aged 65 and older, followed for 8 years. People reported whether they use, and we talked about Rebecca earlier. She's up at Harvard. She was the one who recently did that kind of data mining study on the snooze button that we were talking about, where she was basically saying, "Hey, the snooze button is bad and can lead to all kinds of stuff." Which I'm not a huge fan of the snooze button, but I think in certain populations can be okay. So once again, we're sort of mining data and trying to look for trends. So the design of her study was looking for people who use sleep medication most nights or every night. About 15% of older adults fell into that routine use category. Dementia was assessed with structured cognitive screening and validated algorithms. So the main finding was that routine sleep medication use was associated with a 30% increased risk of incident dementia. After adjusting for age, sex, education, and chronic conditions, which is very important. So this study confirms that the general pattern seen in the UCSF Health ABC paper, more regular use of sleep meds, more dementia down the road. This is using a nationally representative US sample, which is a nice complement to that ABC study. Again, we're looking at all comers here, not a specific small population of people. So important limitations that we should point out. Sleep medication is a broad category. It includes a lot of different drugs with a lot of different mechanisms. Um, are we talking about this is mainly being seen with the Z drugs? Is this mainly an antihistamine effect? Any drug that has PM on the end of it, Tylenol PM, it's Tylenol, which is acetaminophen with an antihistamine. And it's important that we understand that antihistamines, in addition to be antihistamine, can also be sometimes anticholinergic, which is the chemical that's often deficient in patients with Alzheimer's disease. So there's always been a perceived link to people who are using chronic antihistamines, maybe be putting themselves more at risk for dementia down the line. Um, Again, residual confounding is a big issue. And Rebecca was very clear when she pointed all this stuff out. There are people with more severe sleep problems, more psychiatric comorbidity, more health issues in general, maybe more likely to see this neurodegeneration and be more likely to seek out pills. Um, so if you're listening and thinking, well, are these big US data sets saying routine hypnotic use is linked to dementia? The Robin study and the NHATS study, or I'm sorry, the Robin study is yes, that they are linked for sure. The third study is a 2022 study, which was a big meta-analysis of sedative hypnotics. This was the Al-Dawsari paper. Um, from 2022. It was published in the British Journal of Clinical Pharmacology. What they did in the study was they searched literature for observational studies looking at sedative hypnotic use and dementia risk. They included 35 studies in this analysis, and many of them were very large cohort or case-controlled studies. Again, this is retrospective looking, it is not prospective. They pulled the data using random effects models. Key takeaways from that study. Number one, overall, sedative hypnotic use was associated with an increased risk of dementia, roughly in the 20 to 50% relative risk range, depending on the model and exposure definition. Number two, the strongest and most consistent signal came from the benzodiazepines. Valium, Ativan, Klonopin. God, Klonopin, man. You know, when I first started practicing as a doctor, Klonopin was given out like crazy. And it's really interesting. Even today, 2025, I encounter physicians all the time, even sleep physicians, who are a little bit nervous about certain drugs. We've talked about narcolepsy medications on this show quite a bit. I'm a huge advocate for the narcolepsy and hypersomnia population. These drugs are often controlled drugs, as are the benzodiazepine drugs. And it's interesting to me how some doctors will shy away from hypersomnia drugs. Well, I'm a little bit nervous about that because it's a controlled substance and yada, yada, yada. But man, when it comes to the benzodiazepine drugs, they are full steam ahead. And one thing that I've seen over my career has been that attitude really, really changing. So, strongest and most consistent signal came from these benzodiazepines, especially higher cumulative doses and longer durations of use. And this is tough. Do I have patients on benzodiazepines? I do have some. And we're talking about Andrew Spector in his book, Navigating Life with Restless Leg Syndrome. The people that I tend to use benzodiazepines are the most refractory restless leg patients when we've tried everything and these individuals cannot sit down and enjoy a good old fashioned Duke butt kicking of UVA down in Charlotte. Like they're having to pace around the stadium and watch their alma mater because they can't sit still to do that. And I'm saying that thinking of a patient of mine who has season tickets to the UVA basketball team and really can't sit still to watch the game because his restless leg is so bad. So bad. I think benzodiazepines could be a useful agent in those individuals. The results for the non-benzodiazepine hypnotics, like the Ambiens, Zolpidem, and friends, were more mixed. Several studies and specific review of non-benzodiazepine hypnotics did not find a clear link with dementia diagnosis, although data on subtler cognitive outcomes are limited. Finally, the authors were very explicit that the mixed bag of these drugs and the bias, especially confounding by the indication and so the lack of sort of early diagnosis of dementia in these patients may make causality a hard claim. So the counter evidence, not everyone sees the big signal. Let's look at the to keep this podcast honest. Let's look at the flip. Well, before we do, let's take a step back. If you take a step back and pull the entire field of data that we have, all the big cohorts and case-controlled studies, there is a signal that sedative hypnotic use, especially benzodiazepines, are associated with a higher risk of developing dementia. But the meta-analysis also makes it clear that the data is messy. So let's look at the counterpart. I hate sleeping pills. That's my bias. I'm putting it out there. But I do want to say, hey, look, what can we say if we're in the camp of sleeping pills? I always try to put myself in the camp of sleeping pills. I don't want to be somebody who's denying medications that are really helpful, lead to more healthy and less dementia. Whatever. So what's the backside? There was an Osler study in 2020, American Journal of Psychiatry. It was a large Danish cohort that looked at benzodiazepines, Z drugs, and other anxiolytic hypnotics and found no robust association with incident dementia after careful adjustment. That was from 2020. Gerlach in 2022, which was a gerontology study. In older Americans, cumulative benzodiazepine exposure was only minimally associated with dementia risk, and the relationship was not dose dependent. So it sort of argued against that sort of toxic model. The more you take, the more likely you are to have dementia. So it was there. It just wasn't quite as robust as the earlier three studies that we talked about. Final study from BMC Medicine, BMC. I'm blanking on what BMC stands for. British Medical. Ah, gosh, that's BMJ. So I'm sorry, I'm blanking on what BMC stands for. This was BMC Medicine 2024. A more recent community-based cohort also concluded that that while meta-analysis does show a higher risk of benzodiazepines, causal interference is limited and effect size modest. So these studies are saying probably there, but might not be nearly as robust and large as what these other three studies sort of make it out to be. So to be honest and summarize things for our listeners here, we've got some large, well-done studies showing that a 20 to 80% risk in dementia risk with regular hypnotic use, but we've got other large, careful studies that don't see that much of a signal once you really hammer on the confounding variables. And that's really what you want to see. And that's something that I think is lost. And like when we talk about autism and we talk about things of that nature, a lot of the early studies, the data mining studies, are used to sort of generate a hypothesis. Okay, we've got an hypothesis that this vaccine causes a problem or acetaminophen causes a problem. Then what you want to do is sort of next step is to go through and kind of look for confounding sorts of things that might explain that away. And then I think the third step is prospective, which you're not often able to do. Okay, we're going to have two different groups. We're going to give you this drug, and we're going to give you this drug. We're going to try to see who gets autism. That is the study that's never going to happen. So we try to do the best we can with the data that we have. So, what are some possible mechanisms here? Sicker patients do get more meds. So, possible mechanisms. Number one, GABAergic over-inhibition, which we've talked about quite a bit. So, GABA kind of calms things down, that if you're over inhibiting those things over and over every night with these medications, that can lead to sort of a more permanent effect. So chronic benzodiazepine use associated with cognitive impairment in working memory and learning. In some animal models, it suggests that it's actually interfering with synaptic plasticity. Falls, head trauma, delirium. These medications definitely come along with side effects, particularly in the elderly, of confusion, sedation in the morning, falling. So, could we be actually seeing in part a bit of an effect of trauma in these individuals because these drugs are sedating, causing falling, and leading to dementia through more mechanistic mechanisms? Sleep architecture disruption. One of the biggest arguments I make about benzos and similar medications that they often suppress important stages of sleep, REM sleep. They may suppress deep sleep. So, are we chronically changing sleep architecture, and that's the mechanism for dementia? Just like sleep apnea is chronically changing sleep architecture, and maybe that's the reason for dementia, or it's the hypoxia. And I'll tell you, as somebody who looks at a lot of sleep studies, hypoxia is when your oxygen level's dropping. Looking at an individual with like sleep apnea and looking at their oxygen levels, looking at that same person with sleep apnea who takes sleeping pills, wow, that is a double whammy. And I've seen some really low oxygen saturations in people who are taking these sedating medications. So that could also be another mechanism that we're worsening oxygen levels in these people. And certain areas of the brain are very sensitive to decreased oxygen, so we might be hurting them in that way. The competing explanations are equally powerful. Maybe people with sort of prodromal dementia are having episodes with sleep and depression and anxiety. They're more likely to have insomnia, more likely to seek these drugs. They might also see more doctors, be more intensely monitored, and have these types of things sort of picked up more readily. Meaning that if you're interacting with doctors and getting drugs for sleep, you're being seen by doctors and getting drugs for sleep. I have very strict policies in my clinic that if you're on controlled substances, I'm going to see you every 3 months or every 6 months, depending on the level of control of that drug. So I'm going to be interacting with you more frequently than that guy down the street who sees me once every 5 years to get a new CPAP. So I might be more likely, as I'm talking to these patients I'm seeing more frequently, to pick up on subtle changes in cognition, referring them for neuropsychological testing and picking up on dementia. So here's how I would talk about this with a patient. You know my bias. So I would say, look, somebody comes to me and says, look, I saw the UCSF paper. I saw something on social media saying that benzo cause dementia. Should I panic and throw away my pills? My answer is yes. And that's the end of the show. I'm just kidding. I would say, look, there is enough of a signal here and robust research that we should take this seriously. And I'm going to say to you, as I say with a lot of things in life, there are two options here. This is correct that it is causing dementia or it is not. And let's look at your possible responses. You throw away sleeping pills, and it turns out 20 years from now, we realize there was never any risk. Okay, what happened? Well, you threw away some sleeping pills. Who cares? And you can call me up and say, man, you made me throw away those sleeping pills 20 years ago and there wasn't any risk. Man, I wish you hadn't done that for me. I don't think we're going to come to a third conclusion, which is I threw away the pills 20 years ago and it was these were healthy. These were making people better. I don't think that's really on the table. It's either they're hurting you or they're not hurting you. I don't think they're helping you. So let's look at the alternative. You don't throw those pills away and they are causing dementia. So to me, what's the bigger crime? I think the bigger crime is for you to continue these things and potentially hurt yourself versus not continue these things and maybe down the line realize the risk wasn't that big to begin with. Okay, well, whatever. We tried. So to me, there is enough of a signal in this research to take it seriously, but the science is not yet a smoking gun. We can't say for sure that it is causal. We can say that it is a marker for risk in a complicated soup of insomnia, mood disorders, vascular risk factors, neurodegeneration. So, what I would say is if you're thinking about or needing sleeping pills, maybe that's a trigger for us to look a little bit more at your cognitive health, consider diagnostic studies, consider neuropsychological testing as a marker for if you're thinking about asking for sleeping pills or you're chronically on them, maybe we need to accelerate that dementia screening. Number three, regardless of dementia, benzos and hypnotics are clearly problematic. So throw away the dementia. These are not great drugs. They're dirty drugs. They affect your sleep in negative ways. They're addictive. They're costing you money, and they're just not necessary. Short-term, tightly managed use to me is different from nightly use. You're traveling somewhere, you're a shift worker, and you've got a very specific way you use these medications. Chris, every now and then I have to go from nights to days. I'll take them for 3 or 4 days during that transition. Boom, fine. Hey, Chris, my lovely pet passed away, and I'm pretty upset about it. Or, hey, Chris, I'm a UVA Cavalier fan, and I drove down to Charlotte to watch what might have been the worst football game of my entire life, and I'm so upset about it that I can't sleep. Okay, well, here's, some sleeping pills for the next few days until you get over the fact that some college football players didn't perform to your liking. Here are some pills, get over it. Let's move on with your life. You're 53 years old and you graduated from UVA 30 years ago. Move on. Find another hobby. Do some, but yeah, sure, take the pill. That's perfectly fine. But I think that the long term, I've been taking these pills for 30 years because somebody said I needed them to sleep. I think that's what we have to look at. And the safest first line treatment for chronic insomnia is still cognitive behavioral therapy. Certainly had to get a plug in for CBTI. So if you're already on chronic hypnotic, don't yank it. Some of these drugs have to be weaned off. So talk to your doctor about this research. talk to your sleep specialist, seek out expertise, and find a pathway forward and a way to come off these medications. So, three key pieces of evidence: the UCSF study that everybody's talking about, 2023, frequent sleep medication use in older adults, particularly white older adults, 79% higher risk. The Robbins 2021 study, 30% higher risk. And then the Al-Dwari 2022 analysis showed again a very higher risk, particularly with benzodiazepines. Not all high quality studies agree. There are some studies that say that it's not there or it's much smaller. So if you're worried sleeping pills are silently eroding your brain, the answer right now is probably not in some dramatic immediate way, but long-term heavy use, especially with the benzodiazepines. I would do better. I would look towards getting away from these medications. There are better, safer ways to treat your insomnia. So you can take this question, which has not been fully answered, and eliminate it from your life. So that's it. Thank you very much for listening to this podcast. We have a very special episode of the podcast next week, which is all about having a sleep study. If you've never had a sleep study and you're about to have one, this would be a great podcast to listen to because we've never done it. Like, what does it mean to actually have a sleep study? So we'll be talking about that next week. Take a listen to Country House by Blur. Get off of your sleeping pills, eliminate the potential risk for dementia in your life. And until next week, sleep well.